Okay, so good evening, everyone present here. I'm Dr. Gagandeep Kaur from India, and I welcome you all to Global Interdisciplinary Summit 2020. So, after the tremendous, huge, beautiful response with the event, we were moving ahead with one of our prestigious speaker, Dr. Ruth, with us. So, before moving on to the session, I would like to guide everyone to follow the links which are present in the description box for the speaker's schedule for the certification purposes and on. So with this, I would like to welcome Dr. Ruth with us. And speaking about her, I would like to mention that Dr. Ruth is a 2003 graduate with honors from the University of Pavia School of Dentistry. Gifted with a versatile sense of innate curiosity, her diverse capabilities have drawn her to investigate and be instructed in all disciplines of dentistry, including specialist level endodontics, prosthetics, restorative orthodontics, and surgical facial aesthetics. A self described learner at heart, Doctor is a dentist who is always hunger to learn more while striving to apply what she has learned in her daily practice. So with this, I would like to welcome the most beautiful diva, Dr. Ruth, with us.
Thank
So
you.
with this, ma'am, the stage is all yours.
Thank you so much. I hope you can see my screen. And if not, let's try this. Hold on. Where's the... Do you see the presentation?
No, ma'am, not yet.
I'm not share. Hold on. Pardon me.
Yes, ma'am.
Now, we had it before, so there we go. Okay, hello everyone. Thanks for inviting me. This Global Interdisciplinary Summit, it's something amazing that has started in a very particular time where we never thought we would be all joining from our homes. We thought we would be going to some beautiful place and meet in person. So the effort to create this amazing Congress is really special because we've been able to listen to a lot of different speakers and topics and learn in the comfort of our home. As you heard from my description, I love to study, so this was something that was not difficult for me. My name is Dr. Ruth Delli Carpini, and I live and practice in Milano. That's in the north of Italy. And if you've heard about this city or if you had the opportunity of visiting, it's known for its beautiful architecture. Leonardo da Vinci created the Navigli, a network of channels to navigate and connect the different cities, and also we are known for beauty. So this is something that comes natural to me. We are always invested in aesthetics in the form of how we present ourselves, how we get dressed. It permeates every single fiber of the city life. And so this is also what motivated me to be conscious and follow and try to understand more about aging and about what happens to us to preserve beauty. Beauty is the first thing in our mind all the time. Maybe sometimes you think it could be superficial, but if beauty comes from within and is expressed outside, it's a nice balance. So today I will be talking about PRP as a derma filler used in facial rejuvenation. This is my topic, and for this I need to thank Dr. Garg, who cooperates with Dr. Kiran Shah in many different levels, and he's a man that's always been intrigued and interested in beauty, associated with his main discovery, PRP. You may know him as the co-author of the discovery of this amazing technique that helps us retain the platelets from the blood and use them for many purposes in surgery and ultimately in facial aesthetics. And this is the part that I will be doing. And this is why usually presentations can be boring, but I like to underline a couple of things because I want to come across not as someone unattainable, but as someone who in dentistry has done a complete path of studies and development in my profession, in our profession. And so I really hope I can inspire anyone who is a general dentist, a student who's just starting, and even someone who's done general dentistry or a main branch of dentistry for a long time. I want to encourage you to investigate all the different branches because they're definitely at your reach. And PRP for me has been the connecting these different things because it has helped me develop surgically, and it has helped me develop in all the areas of dentistry that I practice. And you'll see how everything is connected together. Dr. Garg, in this beautiful book, Autologous Blood Concentrates, describes perfectly how PRP can be applied to every discipline of dentistry, mainly surgery, and then also facial aesthetics. This is something that it's not new. I'm sure you heard about it. Maybe you have some curiosities, but mainly it was discovered a good 25 years ago. That's a long time that has helped science, research, develop, establish this procedure as very, very safe, effective, and scientifically proven. You hear about stem cells. All of the things that we hear about stemmed out of this first discovery that Dr. Garg and Dr. Marks did 25 years ago. Unfortunately, we have a lot of misinformation, pseudoscience, changes in nomenclature. That means that a lot of people around the world have taken this original discovery, have played with it, but instead of giving credit to its author, have appropriated this technique by changing the name and saying that it had inside some mysterious magical factor, when in the truth it all started with this original discovery, and it was always the same as it is today. Today we're understanding more how we can apply it. We can understand different recipes, but that doesn't change that if you make a pizza and create different topics, the original thing is that it's still a pizza. So originally in 1992, when it was first published, I hope you can see my pointer today, I don't have the magnifying lens, it was called platelet-rich plasma. And then eventually it got a lot of other names. I advise that you go and read for yourself. I like to read. And then I make a little summary of what I retained from what I read. On chapter 7, on the same book, there's the description and the protocols for the application in the rejuvenation of facial aesthetics. So you can, I even help you find the chapter on the book, but then Dr. Garg is coming out with the facial aesthetic book specifically on PRP and several other techniques. So it's going to be really amazing. So facial rejuvenation, you know that it has increased popularity because we talk about the face, the signs of aging, and we know it's very visible in the face when we start going along with our ears. But this is a discipline and an attention that starts from the early 1900s. So when we talk about facial rejuvenation, we talk about cosmetic treatments, a series of procedures whose goal is to restore a youthful appearance to the human face. So basically our goal is to stay young as long as we can. And so this has created the scenario for injectable fillers, because people and doctors and surgeons have tried over the years to go in a direction of minimally invasive procedures. And if we see the Journal of Plastic Reconstruction and Aesthetic Surgery in 2009, Dr. Bach and his colleagues have detailed in a research how the common trend is really directed toward eradicating disease, of course, but using techniques that are focused on skin tightening, and their plastic surgeons' instruments were resecting, resurfaces, more dramatic approaches that don't make them mainstream. Whereas today, knowing that there's other little tips, tricks, and minor procedures, people are directed toward prevention more than ending with facelifts, which sometimes we know can damage nerves and leave a look that it's done, or that gives away the fact that you've had cosmetic surgery. So in recent years, we've been going more natural. We've been understanding the concepts of soft tissue augmentation, using and preferring non-incisional techniques. And so this demand, as of course, as always, directed science and further studies in this field. So we know that we have a variety of possible dermal fillers, and as the word says, or as you may have imagined, to fill means to plump up, to fill up areas. Why? Because they have lost volume and therefore smoothness. We will see in a while how we age, and that's why part of the aging is connected to a loss of bone tissue and of an atrophy of fat pads and our natural soft tissues. And this is why we need to fill them up, mainly because we will have a tighter appearance. So we know it's very famous, the hyaluronic acid. We know it's found in fluids, tissue. So often people refer to hyaluronic acid as extremely safe. The common brands known are Juvederm, Restylane, Belotero. Then we also have calcium hydroxylapatate, which is a mineral-like compound that is found in bones. Its commercial form mainly used is Radiesse. We have polylactic acid, which is a stimulant of the skin. It's called Sculptra, stimulates to produce more collagen. We also have polymethyl methacrylate microsphere. It's a semi-permanent filler. Bellafill is the more common known. And then we also have autologous fat. All of these fillers have desirable aspects to them, but also some which are undesirable, mainly the possibility to reverse their effect in case we don't like it, in case something went wrong. So of course we immediately understand how the characteristic of a perfect filler is to be natural in appearance and in substance, as close as possible to what we have in nature, and at the same time it needs to be easily reversible. So whenever we pick a filler, a choice, we're deciding what we want to do, we need to consider and take risks into account. So we need to think that even fillers which are mainly considered safe, they can create some problems, which are rash, itching, redness, bruising, bleeding, swelling. Allergic reactions are very rare but possible. Asymmetry, the creation of lumps, nodules, inflammatory response that can be immediate or can be delayed, and also the risk of overcorrection. So these are the minor risks we just mentioned, but the main risks we all know is vascular occlusion. And vascular occlusion happens when we inject hyaluronic acid or any other type of dermal filler within an artery. And this blocks the blood flow through the vessels. And so we can have necrosis in some areas that are irradiated by the same blood vessels and the network deriving from this one, and also blindness. This is the scariest of the possible consequences, but if you think of the complexity of anatomy, many of the areas which are normally naturally treated during rejuvenation, as the nasolabial folds, the tear troughs, can easily, even the lips, can easily cause blindness to the eye because of the network of blood vessels connected to the angular artery up here that in turn turns into the retinal artery. So this is not a minor problem and risks. It's very small in numbers, but when it happens, it's very dramatic. So of course we want to be trained, do everything possible to avoid it. But at the same time, if we could choose a pattern, a path, a filler that it's safer, why not? Everyone's happy and we don't have any risks. In this picture, you can see that if you think you're that good injecting any face without crossing or touching any blood vessel, that's a little bit utopistic because the face is extremely vascularized by minute and number of complex network, as we said before, of blood vessels. And as I was mentioning just the previous slide, we have a very close connection from the facial artery going into the angular artery and into the retinal artery. So of course, the safer, the better, and we need to learn, and we cannot. And this is why I focus a little more, even though some may think it's boring, on the facial anatomy, because it's very paramount to success in the practice of facial aesthetic to know anatomy, and so to focus on knowing the safe zones and what the risk areas are and how to avoid it. So right now we talked about things we all know, and how did we even think about going to PRP and use it as a dermal filler. I found in my research this patent submitted in 2001 in Canada by Dr. Orentreich Norman and his associates, who described the materials that could be used for soft tissue augmentation, and eventually came to the conclusions that many of these materials have several risks associated with them. We talked about that. They have an unpredictable result and longevity to them. And we also know that in the breaking down of several other fillers, because they're foreign. We always say, I mentioned it at the beginning, that we say that hyaluronic acid, it's in our own body, true, but what we inject, it's not our own. It comes from the industry, it's vehiculated by carriers, and so all of these additions can create problems. They make unpredictable the end result, and also how the body responds to them. Not only that, but then in the breaking down, we know that protease enzymes go and react with the foreign body that's been introduced. That can be as tolerable as you want, but the body will try to get rid of it, of course. In the PRP, we notice that these enzymes are less activated, and so the breaking down is much less than it would be toward a dermal filler. We'll see in a minute the whole protocol, how we do it, why it lasts. And so this Dr. Orentreich understood that by denaturing the proteins and mimicking the process of cross-linking that we have for hyaluronic acid derma filler, we produced a stable form of PRP. And the protease enzymes are the ones that we are very grateful for, because it makes the scale drip toward the side of preferring something natural, less resorbable, that will blend perfectly with our skin. This is the patent. If you want to look it up, or if later on you give us our contacts, I can make sure I'll send you the PDF so you can read for yourself the whole research, but it's been extensively researched and applied and approved. So what is plasma protein filler, PRP, dermal filler, call it as you want. Basically, it's made from the patient owns plasma, and that's, I'm pretty sure you figured out by yourselves. And so it happens by denaturing the plasma by heat, and then combining the hard obtained gel with the bioactive ingredients of our PRP. And inside it, we know we find growth factors, stem cells. We'll see them in detail in a minute, CD34 plus. This is a very important factor that we have isolated in the PRP, and it's a transmembrane phosphoglycoprotein, which is a surface antigen expressed in blood vessels and in the line of hematopoietic stem cells. You'll see, if you follow my review, how everything ties together and how each one of these components actually helps exactly for the reasons why we age, being a counterpart to them. And so that's the exciting part about PRP as plasma filler. So just like we said before, the goal of PRP as a filler is to volumize, to lift the cheeks, the nasolabial folds, the jawline, the lips, and it allows us to obtain a totally natural facelift. That's the exciting and desirable part about it. So the advantages of the PRP, we already started understanding a little bit of what the advantages could be over other types of fillers, but it also has an advantage compared to another autologous filler, which is fat. Fat has been used as a filler for the face, for different areas of the body in many, many years. But the reason why PRP is even more desirable than autologous fat, and it's more appropriate for dentists, is for sure the fact that we can't harvest the fat in different areas as plastic surgeons would. But at the same time, autologous fat has some limitations because of the consistency, because also of the color, which, if injected in the lips, tends to tint them whitish rather than the nice pink, beautiful, luscious lips that we instead desire to obtain. So the leftover color, it's not exactly ideal, and the consistency is very similar. So this again tends to make the scale go toward the PRP, because as well it doesn't have any allergic reaction, comes from the patient's own blood. It doesn't create trauma in the harvesting, so the patients are very excited and tend to prefer whatever doesn't give them a long-lasting side effect, bruising, before they can go back to normal. And it's soft, subtle. It becomes the cheek of the patient. It becomes their face. It doesn't only lift by being under. And this is extremely nice, and you'll see how when I'll show you my cases. So the advantages is that we can use it in a variety of ways to lift and augment small, deep wrinkles. We can use and lift large areas of the skin. I'll show you how. I have a few videos. But the fantastic part of it is, because we will be mixing the hard part with the liquid gold, as I like to call it, we can promote cellular regeneration, increase collagen production, and prevent the loss of further structure. Therefore, actually starting and stopping the process of aging itself. We know we can mold the face contours. So if we have a trait of the face that wasn't desirable to the patient, we can address that and create beautiful proportions, and so even improve something that wasn't there. It doesn't only mean that we can restore the way we were. If something wasn't in balance, we can make it more desirable. And over time, it dissolves smoothly without creating lumps, bumps, strange presence under the skin. Whereas other types of fillers don't regress and dissolve as smoothly. So what do we know about PRP and about the main components? We don't know that it's concentrate of platelets, which are thrombocytes, cytoplasmatic fragments of megakaryocytes, which is produced in the bone marrow and enters the circulation as anucleated cells. We know it only has 10 days of lifespan, and we know that it's a metabolically active cell secreting growth factors and releasing them in response to coagulation. Not only that, but the platelets we see here are embedded with little storage units which contain granules when they are activated. And pay attention to this word activated, because that's what's going to be significant in the procedure and the protocol to use PRP. And Dr. Garg wrote a beautiful article in August 2011 on the dental of implantology, talking about exactly the uses and the reasons and the why scientifically of the platelets. If you want to freshen up your memory, you can definitely go and read that article. And again, ask us if you want us to share the article with you. So the stem cells we know are pluripotent cells, as Dr. Garg likes to say, and I love this description, which don't know yet what they want to do with their lives, okay? So they're cells that can become anything, and so they have a process of developing and maturing in megakaryocytes, eventually they become platelets, and in the end they become activated platelets. And the activated platelets have these little cytoplasmatic fragments and little storage units, as we said, which will contain the granules, the growth factors, and release them at the appropriate time. And this releasing them at the appropriate time is extremely important. We love the platelets so much, they can be also pretty cute. And so what's particularly important of the platelets is that they release an extremely high concentration of biologically active proteins, and they initiate, support, and develop the recruitment, the growth of cell morphogenesis. Why is this important? We know that as we age, we don't produce as much collagen. All the processes, the biological processes slow down or eventually even become dormant. But if we can support and stimulate new lines of cell differentiation, you understand how this is what produces the rejuvenation, not just the filling, not just the act of adding something that was missing, is the act of finally stimulating again the cells that were not developing and were not differentiating again because of age and all the situations that happen in life. This article by Anetua, 2009 and 8 as well, describe exactly that. A little more patience before we jump into the protocols. It's very important, if we're using PRP, to understand what exactly does it contain. And we know it contains the PDGF, which is the platelet-derived growth factor. Why is this important? Because it enhances the blood vessel growth, the cellular growth, and the tissue regeneration. We also have the VEGF, my personal favorite, and I'll show you why in a minute. It's the vascular endothelial growth factor. And why is this special? Because it promotes the growth of new blood vessels. And again, in an area, why was it dying? Why was it not producing? Because it didn't have blood. We know blood has life. We see the children white and red with those beautiful cheeks. Why are they of that beautiful color? Why do we become paler with age? Because we don't have as many blood vessels. And so if we can inject and stimulate again, jumpstart, kick the production of new factors and new blood vessels, then we oxygenate the tissues better, and all of the processes will start again and be implemented. At the same time, we have the EGF, the epidermal growth factor, which stimulates the growth and differentiation of cells. See how we're working on different levels: cellular, epidermal, vascular, and we are transforming also with the TGF factor, the matrix. We're creating the scaffold, we're giving the nutrients, and we are creating the whole network and architecture of the face. And that's the beauty of the stem cells, that they can become anything we really need, and it's all concentrated in the same place. And again, the bone metabolism, we'll see in a little while how aging happens. The bone metabolism is fundamental. The fibroblast growth factor, the FGF, helps in the specific differentiation of the cells and the vessels. So this aids the newborn blood vessels, helps direct how the cells that we just started to differentiate need to mature. And then the EGF, the insulin-like growth factor, modulates this process within the cell. So it's amazing to see how we have angiogenesis, mitogenesis, we create new cells, macrophage activation. Why is this important? Because at the same time, not only is it safe, analergic, we saw a wonderful number of factors that are desirable in the product that we're using, we also have the possibility of injecting an anti-inflammatory at the same time, because the platelets activate the macrophages. And so this creates long-term healing, bone regeneration and remodeling because of bone morphoprotein number 2, and regulates the response. So the swelling of the procedure that we've done. And so it's very common that the patient leaves our office without showing that they had anything done other than a very smooth improvement. And so the 3 types of granules that are contained in the storage units of the platelets regulate the blood flow, create and offer ions for the metabolism of the bone, and kill microbes, furthering this improvement of healing. So it's really, really amazing what we can do. So in the plasma protein filler, we have the main percentage. What are we doing? What are we cooking in the pot? We are cooking albumins, which constitute the 55% of our plasma, and they have a very important role of creating and maintaining balance in the body and within the extra and intracellular matrix, maintaining oncotic pressure. The rest of the proteins are also very important because they participate in the immune system, they help with the blood coagulation, they regulate the gene expression, and they convert the fibrinogen in fibrin. But mainly we say that it's an albumin gel that we're producing. Okay, finally, we did the scientific part. Hope you didn't get too bored, but it's really important because this helps you promote what you're doing to your patient if you understand why it's so special and why bother compared to other fillers that are more easily and readily available. So we can get started. Osteolife Biomedical, I thank for the supply of the equipment. The centrifuge that I use is this one, Med Equip. And then you need a warmer for the plasma, okay? So first things first, we definitely need to get the blood. So we start with the venipuncture. And in my case, I prefer to use a cannula for IV. And I'll show you how and why in a minute, because no blood, no party. Why is my preference a cannula? First of all, believe it or not, it's less traumatic than a needle. So it's a one poke technique, because many times at the beginning, you don't know how much blood you need to draw. And also, anything can happen. You can drop the vial, you can decide you want a little more. But the thing that sold me out to this technique of venipuncture is the fact that it has less hemolysis. What does that mean? Less hemolysis means better quality blood right at the beginning. And also, I'll show you, it's very easy for people who have never done a blood draw in their lives, because after a little moment in which you can learn the dexterity to insert a catheter, it's extremely quick. If you see the vein, if you manage to even poke the vein, you're in the vein and it goes smoothly. And I like to say it's blood on tap. So I have a little video, final little action that you can see. And this video is less than a minute. And it was also one of the first times that I was getting video recorded. So the little bit of time that you see needed, it's only because I'm trying to make sure that the person recording can see the procedure. And but it takes even less than that once you become quick. And so it's very easy, very relaxed, and also very clean. And on there you attach your vial and then draw it. See, the little bit of dexterity and symmetry that you need to learn is by pulling out the little needle that's here and placing the drawing unit that I'm the hub that I'm holding in my hand right there. See, easy, simple, and you can draw as much blood as you want. This is my signature mark, the little cartoon band-aid, and it can be also quite fun. So seriously talking, what type of vials we use? The ones with the anticoagulant. So it's the yellow tubes, but maybe all over the world you can have different type of tubes. I want to underline that there's no fear in using the anticoagulant. It's not a dirty word. I like to lay the foundations of what I'm going to say. And if you remember a little while ago, I said that what delivers the growth factors is the activations of the platelets. So in this particular procedure, we don't want to activate the platelets until it's time to inject them. So it's very user-friendly as a procedure. The anticoagulant is a citrate dextrose, and it's contained in the proportion of 1.5 ml in an 8 ml tubes. Usually we draw maybe 4 to do a facial aesthetic treatment, and we spin it at 1,000 up until 22,000 RPMs, 8 to 12 minutes. So the anticoagulant contained is called solution A, and is also the one that it's used in all hospitals to prevent the clotting of the blood from the vials, because anytime we do a blood draw, we need to study the cells and measure them and count them. And we also, when we do blood transfusion, we need to make sure the blood doesn't coagulate. And this is the same anticoagulant that it's used in those procedures in the hospitals. So it's extremely safe, used every day, doesn't have to be demonized, and allows us the working time so that we can only do one blood draw at the very beginning, do our procedures, process our plasma, obtain a filler, and then with all ease start to inject it on the patient. And the settings are drawn from Dr. Garg's protocol. So it's 1000 up until 2200 RPMs, and sometimes you can have the G-force described. You have to check with your manufacturer's instructions for your own centrifuge. We don't need to have one or the other, but that's why it varies between 1000 and 2200, or between 8 to 12. I like to go 2200 for 12 minutes, and I see a better separation of the platelets. And as you see, this is the hub that we applied before. The blood flows very easily through the vial, very quickly. This is not being sped up. This is the yellow tube that you see, we've got plenty of here. And this is how easy it is to place them into the centrifuge and then be activated and go. I was hoping that you could see the setting, but it's 12 minutes for 2200. So this is what it looks like when it's been centrifuged. Out of the centrifuge, you see a very good separation and a gradient of colors in the vial. And I have a slide that shows you exactly what's inside. But what we're after is this part in this transaction toward the red blood cells, because that's the most potent, and it's the one that we call liquid gold. So the separation into the vial is in 3 different layers. On the top, we have the platelet poor plasma. In the middle, which is about 2 mLs. In the middle, we have the platelet-rich plasma, about 1.5 to 2 mLs. And then in the bottom, we have the super-rich platelet-rich plasma. And this is the part that we extract at this point. We put on the side, it's about 0.5, even a little more I draw at this point. And I put it in a syringe, I put it on the side, and then the top part, the middle part we can use for microneedling. And the top part, because it's platelet poor plasma, and so it means that it's a little better than a saline. It's still saline you buy in the store, and blood you have it, it's your own, so it's highly desirable. That one is what we use to create the filler. And so we use the machine that will heat the plasma up, and in sensitive areas we can do 65 degrees for 8 minutes. For more strong augmentations, when we want the plasma thicker, we use a temperature of 75 degrees for 8 to 10 minutes, a little more. You have to play with it and see how you can be a little scientist. These are the suggested temperatures, but then you see that it will become natural for you to experiment a little more, a little less, and see what works for you. In the cheeks and the lips, usually the advised settings are of 65 degrees Celsius for 10 to 12 minutes. And I want to show you this machine, for me, is more desirable than other ones. I've tested several other ones, but in a sense of workflow in the office, this one is very easy to use. And you will see here, if you can hear that it makes a noise, it's because it has a fan that lowers the temperature from the one where it was active and ready to a temperature that it's body compatible. Of course, you can't put 60 degrees, 75 degrees in conjunction with the PRP liquid. This is the one that it's been obtained, subtracting 0.5 from each vial, and put on the side, and then will be mixed with the syringe of the heated plasma. And this is the consistency that we obtain. You can see that if we leave it as it is, it's kind of albumin, like an egg, white, that's being cooked, and it stays pretty stable and it breaks down in pieces. So when I saw that it was that thick, I thought that the way to deliver it, if I wanted to make a major augmentation, was to use a bigger cannula. This is, I think, a 23 or even a 19, 18 gauge, I don't remember. It was from some video threads, and I was just experimenting. Of course, the bigger, the more solid it can be to put, let's say, under the cheeks. Of course, it's not appropriate for a fine detailing of the lips, but for major augmentations and areas is definitely desirable to use this type of thickness. And you saw from the me squeezing the gauze that even when you have absorbed the liquid part, you still have a volume that holds its shape. And if you place it in the right places, it will be stable and not go everywhere. We use a 3 ways lure lock. You can find the 2 ways. The concept is that you will be pressing back and forth between 2 syringes. In one, originally you had, this is the more active part, the pure gold. This is the one that's a little less rich, the platelet rich plasma, the one that was in the middle layer. And this is the one that we can use for facial microneedling for the hair. So it can be used in a number of ways. And if you want to use the filler, you can definitely mix it with the liquid gold and obtain one syringe, more milliliters that you can use for your restorative procedures. So what happens here? Why do we have this picture of this vial? This is a buffering solution that we sometimes, in the liquid form, if we're injecting on the periosteum, it could be perceived as a little burning because the pH of the PRP is a little acidic. It's not a toxic acidic. It's an acidic that can stimulate the nerve endings, and so give the sensation of a little bit of a burn, but it's nothing that should worry you. It will create a little bit of erythema, a little bit of redness, but it's amazing how under your eyes the redness happens and then it goes away. There's also a little bit of a tingling of the skin, but just in case you want to make it extremely comfortable for your patients, we use sodium bicarbonate with a concentration of 8.4% and add it to the vial with a ratio of 1:5. So what can we do with PRP? What's the goal of all this regeneration? We, of course, as I said before, need to develop a deep and intimate understanding. That's the difference between the dentist and the plastic surgeon. No magic wand. It's just an extreme deep knowledge of all the areas of the face, the skin, the facial anatomy, and the physiology of aging. And if you like to give a look to this article about the retaining ligaments of the face by Dr. Mohamed Al-Gul, it's a beautiful article that explains very well how the retaining ligaments need to be the areas where we aim to place filler, because if we lift the retaining ligaments in the areas where they hold the skin, we will need less product. So what causes aging? The physiology of aging, of course, we know smog, an excessive lifestyle, smoking, exposure to polluted environments. But what many people don't think about is rapid weight loss or frequent fluctuations in weight. Also, people who are more fit, they will exhibit quicker aging of the face in particular, whereas the body may look younger, stronger. Unfortunately, the excess of testosterone and also of lactic acid that is produced normally during a very active lifestyle will drain the face and make it look gaunt easier and quicker than people who don't exercise as much. We know that the triangles, if you've ever heard or read anything about facial aesthetics, we say that the triangles of the face get inverted. If you do orthodontics, you use to evaluate also the aesthetic profile of the patient. And so that means that we have a different size also across sideways between the temples and the rest of the face. And why does this happen? I was mentioning before the bone morphoprotein, but what happens is that we lose bone structure and volume. We go through atrophy, but we have mainly bone loss. And so if you think about it, if I have pardon, I like this example. If I have a tablecloth, which normally covers something a certain way, it will drape nicely if it's the proper tablecloth for the proper table. But if I take something else that's smaller, see how it will fall. And so this is what happens to the skin. The same tablecloth, our face, doesn't change. What changes is what lies under, the levels, the structures, the layers. And so the top layer stays the same, but the middle layer, the bottom layer, and the bone all become smaller. And this is why the skin falls down and sags. As I was mentioning, we have superficial and deep compartments, fat pads, but these compartments, I like to point your attentions out to them because they function as isolated pockets. And this is very important because the retaining ligaments, if you see my mouse arrow, will define and isolate each of these pockets and each of these layers. And so you know that when you inject your filler, they will stay here and not disperse other ways. Of course, the liquid part will be absorbed, but the part that I showed you as solid will stay exactly in place where I've placed it. So mainly patients come to us because they immediately start seeing the nasolabial fold, which is not a pathology, it's not a problem, it's a normal part of the human anatomy, it's not a medical condition. But of course, as we get older, these parts start sagging, and that's why the patient comes to us to relieve them. And when we push them on this side, you see that they're called marionette lines, and that's why the patient comes to you. He says, "Oh, doctor, I see that I have marionette lines, I have my nasolabial folds." They know terms better than you do sometimes, and we have a nice picture here of how the same face ages over time, and you see the concept on the first layer of the skin. How does it show? With wrinkles. On the second layer of the skin, the fat pads become smaller and we see that the skin sags. But on ultimate analysis, it's the bone, and here we see that, which shrinks and becomes smaller. Dr. Snezana Paul allowed me to use this slide from one of her lectures, and she was talking about partial extraction therapy, and see how everything is connected. The alveolar bone, this is a study that was made on the alveolar bone over 5 years, and showed how the natural resorption of the alveolar bone in 5 years is in the range of 0.5 centimeters. So that means that over years, we really lose volume in a very significant way. And this is why it's desirable to inject PRP in the liquid form, in the gold form, in the more pure form, because that part will stimulate the bone at the level of the periosteum and will not allow somewhat, this is our desire, for aging to keep going. So the sooner you start, the better. But even if you start at a later stage, you can definitely recuperate many, many years in appearance. So which are our goals? Beauty, of course. Proportion. We don't want to create monsters. We know that the main areas of concerns are the lid, the cheek, the malar, fat pad, the nasolabial fold. We have different levels of restoration, which can be superficial, deep. The reason why I'm putting so many anatomical pictures, number one, because I want to ingrain it in your mind that anatomy needs to be your best friend and ally. And as you keep an ortho Panorex next to your chair to visualize constantly and refer to it, or a CBCT section and picture close by when you're working and doing surgery and doing any other thing, even endodontics, we constantly refer to our x-ray. So why not refer to a picture? And this shows you better how there are pockets and holes under the skin and the skull where we can deposit some filler. And the retaining ligaments are areas that are intimately connected with our areas of interest in the rejuvenation, as we said: nasolabial folds, under eye, the tear troughs, the cheeks, the jawline, but the ligaments can be our ally in holding the filler. So when we're talking PRP, what's the protocol? What does it do? How do you use it? Everyone always asks me this question: how long does it last? 2 or 3 treatments may be necessary. We, of course, always need to differentiate and so evaluate the patient. First of all, manage their expectation. So depending on what age are we starting, what are we trying to restore, how bad the situation is, we will need 2, 3 treatments, which will stimulate the natural collagen, will create the scaffold, and will create new blood vessel, the whole army of things that will help improve. But how long does it last? That's what everyone is asking. And it lasts easily 4, 6, 8 months. And then the more you do it, the less sessions you will need. Usually it can even last up to 2, 3 years after you have done this cycle of every 2, 3 restorations or sessions. It really varies, but you can definitely tell your patients that the single session can last up to 6 months, because if in some ways you have not injected it properly, you may feel the lump and it lasts for several months. So if you want a long-lasting reconstruction, you definitely need to do more sessions, but then you can expect it to last up to a couple of years and even more. It really depends on how young the person is, how they respond, but it's amazing what PRP plasma filler can do. And this is one of our first patients that we did. In the picture, she didn't open her eyes properly, but you can definitely notice how she's a textbook case with tear trough, nasolabial folds, malar fat pad, jowls. And this is before and after. You can question the quality of the picture, and it wasn't me that took the pictures before and after. But what's amazing is that this is really immediately after, and immediately she looks softer, and this will improve over time. That's another thing that we need to consider: the myomodulation effects of the muscle. When we have aging, the muscles need to drape over the skull in a different way, as some of them become hypertrophic. And so when we restore the volume underlying the skin, the muscles myomodulate. So neural signals are sent to our muscles, which will in turn relax them and distend them even more. So over time, the effect is beautiful also for this completely natural triggering mechanism, which helps the face go back to the movements and to the position that it once had. helping even more the result of natural lift. And you see here from the side how the patient is flat, and here we have a nice natural cheek. We restored the lips a little bit, and it all depends on you, on what your patient wants, on what your vision of beauty is. But what's really nice is that no one can tell. Of course, now she's a little red. Tomorrow, she'll be absolutely perfect. And we filled nicely under the eye. The difference is amazing. You see the before and after. And now we have a case of a model 30 years old. Some of them come really young because they don't want to age. A model has a specific request to be able to compete with 15-year-olds. And we know this sounds a little out of line, sounds crazy, but that's things that happen in life. Her concerns were the frown line, the loss of volume. She's really skinny, hollow under the eyes. Then you see here the before and after. She's definitely a beautiful girl. No one's going out and telling her that she's ugly and that's why she needs treatment. She came and seek treatment because she wants to feel fresher, a little healthier. That's were her words. And here you see the before and after, how under the eye it's really dark, the lips are really dry, they don't eat much. And here we have an healthy glow. And again, it's right after, because here you can see the entry point of my cannula, and on the rest of the face, you almost don't see anything I did, but I did the forehead. So I injected in a very dangerous area with a cannula, with a safe technique, but an area that normally would intimidate dentists. And why can I? Because it's completely safe. And here are the nasolabial folds. Again, this can be tricky because we remember that the facial artery travels up to the ungular artery all the way to the eye, but with PRP, it was safe and sound, and no issues or side effects whatsoever. See how the cheek augmentation, even though very minor, gives a 3D contour to the face. Normally you would do that with makeup, but here we can do it with our PRP. The lips definitely were improved by a little plumping. And here's the before and after more in detail. You see the light, the reflection. You want to take pictures of your patient because you see how the area is absolutely lifted. And see how the color, this is just a little bit of Vaseline immediately after. I don't know if you can see the lips properly. Immediately after, and it's amazing and beautiful. And it was one of the first cases. And from the first picture to the last picture, do you see how under your very eyes, the swelling settles and it looks better at each picture? This is the same section, 2 seconds, one after the other as I was taking the picture. But here it already looks better. It already looks like she came with lips like that. How not appropriate are they for a girl this young? Doesn't she look much older here? Tired, sad, and instead here she has an amazing, beautiful glow. And here you can hear from
Morning.
Maya.
So it's the day after my treatment, and as you can see, most of the swelling is gone. I've got no makeup, just had a shower, feeling fresh, and actually very happy in my own skin. Finally.
See, you can see here from a normal phone that she's very happy with the results. They're very natural. This is her own phone picture from home, and the contour are still there, and they will stay there for months. The swelling is almost gone. The forehead, you don't see anything, and definitely is not going to need any more Botox. So this is a gentleman. Even gentlemen like to be treated. I'll show you a little video that I did in which you see the different faces. And as I told you, I use a cannula. I go under the retaining ligament and the muscles, and you see how the cheek plumps right before your eyes. It gets bigger. Of course, we're not exaggerating. We are giving him again a cheek like he would have, like it's appropriate for his body frame. but it happens very easily and smoothly. I am weaving with different threads of material under the skin, addressing the lower fat pads. You see here, this one was already done. And I am filling up the pocket that I showed you in the picture. And so the before and after, it's minor, it's true, but that's what the patient wants. And this is what you see. This is the before and after. This is the area where we used, where we augmented. See how naturally it blends in, how beautiful it looks. The before and after. This is a couple of weeks after. See how it sags, comes down. And do you notice it's minor, but we do endodontics, we do surgery. And so we're used to notice the minor change, but what a big change it makes in the patient's self-esteem. See here how this side goes much lower over here, and here it's smoothly better. You want to see a little detail? My picture out here. A little detail of the injection. I am entering from one single entry point, so it's really not traumatic. And slowly I slide the cannula under the muscle really deep. When you place your filler in this position, it's going to be very natural as a result, because whatever moves is the patient's own muscle and fat pads, and we're only augmenting it from the side, and it doesn't look like it has anything under, because we use this careful approach to stay under the muscle. I want to go a little fast, maybe it's boring, but basically it shows you how it fills up nicely and easily, and the patient is totally relaxed. The only anesthetic we used was here in the entry point. There's no marks, no trauma, nowhere, absolutely. And he's looking like he's in a spa. And what I want to make sure you notice, why was I saying that it stays where we put it? This place of the cannula is exactly the pre-zygomatic space contained by the retaining ligaments and isolated from the rest of the structures. Here's a better view of the pre-zygomatic space, and this is the area that we want to fill, because this is going to look natural. The before and after of the gentleman, here's where it looks flat, and here is filled up, and it will sit down nicely in a couple of days. And here you see another before and after. You see the marionette lines, the lips a little sad, the submental groove extremely noticeable. And this is right after PRP dermal filler. And if you ask yourself, does it last? Of course it does. That's me, I can testify. And you see the loss of volume, extremely loss of volume, and so extremely draping of the skin. And I'm here right before you. You can see that it doesn't drape anymore. And it's all PRP, and it definitely lasts as long as you want. And it helps us go back to the way we used to look. This is one other case with this pretty girl. Again here, she looks pretty flat. She doesn't look as feminine on the after. A little bit of cheeks, a little bit of augmenting of the lips makes the light hit in a particular way that looks extremely graceful. And this is what I did. Her pictures the day after, and a couple more treatments. Unfortunately, she went somewhere else to get her lips done. And this is why you need to tell your patients that they need to be patient in the building of beautiful lips to look natural. She looked beautiful here. When someone else filled her lips, not so much. The patient writes to you extremely happy. They really love the results, and these results are totally natural with no makeup. And this is one other patient again. The lips, now we use a finer needle because right away, it looks a little full, but then you can see how flat she was in the malar area, how pronounced the nasolabial folds were, the tear troughs. And here she looks beautiful with a little small augmentation. And on the 3D side, you see how beautiful the cheek is, how the lips are not over projected. PRP sometimes tend to swell a little bit, but then they settle nicely. And what we're looking for is the OGV curve of beauty here. That's what you need, that it has to have a continuous line all the way up to the cheek. One other area of injection is in the canine fossa, straight to the periosteum, and we're in a totally safe area. Less is more, so we put under the retaining ligaments a bolus of material, and these are the muscles under which we like to augment to obtain the myomodulating effects that I was talking about previously. And you see that if we go to the canine fossa, we don't have any important vital dangerous structures around. And here you see how easy it is with a cannula, with no trauma, to go around the eye in an area that's highly dangerous, vascularized. But why are we so comfortable? Because it's completely safe and there's no side effects. And PRP is a wonderful way to get yourself acquainted to the world of facial aesthetics, because there's no going wrong. Of course, it's important to be trained and understand the placement, the techniques of, but see how this patient was really scared, and here she's smiling because she really doesn't feel anything. It's a little strange, a little weird, she says, but it's definitely not painful, and I have not additioned any anesthetic other than into the entry point, because I don't want to inject a lot of liquid in the sense of anesthetic if I can avoid it. This is why my technique is really delicate, because this way I can make sure that I place only the volume that I ultimately want there. Now she starts to bleed from the little pinpoint, no big deal, but it's hard to continue with the treatment and so on. You need to wait a minute that it stops bleeding, and then you can go back in. And this is how natural the lips look, straight from and fresh from the needle. You can see different sides, different, you massage a little bit, but it really doesn't need that much. Here, maybe I thought I needed a little bit of augmentation in that area. Then you press it in position with the gauze. Here I'm holding the blood. She tends to bleed a little, but it wasn't even that much, and she didn't create any bruise. And then you mold with, you see how the liquid form comes and is extruded very easily through the needle. And here we're going again on the lips, the tip of the Cupid's bow. We have the columnar artery right there, and again goes straight to the eye. So you're doing the lips. How do I go cause problems in the eyes? Because of the columella artery right here. And usually, if you're not careful, if you're using hyaluronic acid, you can go straight into it. So it's of course necessary to learn how not to create problems like that. But with our PRP, we're safe, and we just move on. This is one of the last few cases, and maybe the last one, and see how even in the temple area, remember I was telling you how we lose volume across, and it starts from here. The lady has quite a good tone of her skin, but the volume loss here is incredible. And this is not immediately after, a couple of days after the treatment, where we filled the temple area. Again, area that is dangerous. Usually dentists will not want to go there, but safe, and of our PRP filler. And this is why I like the vascular endothelial factor. Do you see how, sure, it's a different picture, different setting, but do you see how finally the skin glows? This is what happens after you use PRP. We did a treatment of microneedling. We used it under the skin, and immediately it pops out and it becomes, she has no makeup here, only a little bit of mascara, and it looks incredible. And this is the amount of loss that you had on the side. Where did we inject? And even here, it's a dangerous area, but we go in the temporal hollow through the skin and under the fascia with the cannula on the periosteum as deep as we can, where we don't have any blood vessels, and the emergency of these blood vessels is not here. So we are completely safe. Different patient, same procedure, but I know if you've been patient up until this moment, you might want to see a little action. So I show you how easily it is to go and inject under this area with the patient that of course feels a little strange, but is not anesthetized other than on the entry point. And she feels completely relaxed. She's smiling with me and laughing. And so you advance the cannula. When she feels and looks a little bit in pain is because we are hitting this supraorbital fine ends of the nerves, supratrochlear, supraorbital, the little nerves of the temples that become more and more dispersed in this region. But if the patient hurts, you're not traumatizing the nerve, you're touching it, so it hurts. And so all you have to do, see how she's laughing, is move around a little bit. And that's the beauty of cannula technique. And I'll go fast, otherwise we'll stay here 3 days. We can go here and look on the other side of the screen, how from the same entry point we can go up or we can go down under the eye and proceed feeling where the volume loss is. Same concept everywhere. And again, she flinches only the time that I touch the nerve, but I'm very relaxed because I'm not traumatizing the nerve. Touch the nerve, excuse me, I move to the side, I go somewhere else, and then these are the results, and see how full this area finally looks. So if I manage to ignite your passion, to make you curious about PRP and plasma protein filler, we have a beautiful article by Dr. Maria del Pilar Rios, Dr. Arun Garg, Dr. Kurtzman, Dr. Rossi. They've done a wonderful research. This is about the fifth generation plasma. There's a further protocol that involves a double spin of your liquid part, which concentrates even more the platelets and the good stuff in the PRP. And the reason why you want to do that is that way you can inject in specific area a super potent PRP, and they also heat the plasma, and it's a beautiful read. We have courses in the Dominican Republic with Dr. Garg, and if you follow me, you write to Maria at implantseminars.com, you can find all the things that are going on, and follow me on Facebook and Instagram. I'll put a little bit of everything. So I want to thank you for the opportunity and for being patient with me up until this moment. So let's put, can you hear me?
Yes, ma'am.
Okay. How are you doing? Thank you. Let's put this picture on top. So there we go. And all your questions that you may have, I'll be very happy to answer.
Thank you so much for the wonderful oration and moreover the cases you've shown. I mean, how PRP can be, can replace makeups that have you just beautifully presented that. It was quite beautiful. Okay, so, it seems that this session was very, very interesting and everybody has a lot of questions to ask
Okay.
you. Okay, so we'll move on to the questionnaire. We have one from Dr. Sherry. Hi, doctor. Are there any side effects using fillers? And how long is the effect of derma fillers?
Okay, we're talking PRP filler, of course, and side effects, you don't have any. You really don't, because if you think about it, is so natural, and you don't have anything that interferes with it. So it comes sterile straight from your bloodstream, and then it's processed in sterile environment, used with sterile syringes. There's absolutely no risks. The only risks that are attached to this procedure is if you don't pay very close attention to sterilization. And so the prepping of the skin, the cleaning of the skin, the lowering the bacteria film that might be on the skin, on the hand, anywhere. So this needs to be operated in very sterile, clean conditions. But once you have done that, you use everything sterile, you introduce a sterile product, there's really no risks whatsoever. Of course, the patient needs to be also very careful. The nice thing is this is what really gets me so excited, because you poke in one area, the growth factors, the blood and the PRP heals the little hole. So even after a minute, let's say, by the time they go home, all those pores are closed, sealed, and healed. Now, just for a precaution, we suggest not to use makeup, to wait until the day after, and all of that. But really, they could do whatever they want, and there's absolutely no side effects. That's the amazing part of it.
Definitely, ma'am. But ma'am, there's a famous quote that everything in excess, if it's in excess, so it will cause harm. So PRP in excess won't cause any sort of side effects?
Sorry?
Ma'am, like, everything in excess causes harm. So if
Right.
we are injecting PRP in excess, so won't it cause any sort of harm?
No, it will not. The only thing, and this is why you see many times when I show my cases, some people kind of comment that maybe the change is not so visible. And that's where you have to develop your artistic eye. And this is why we see so many botched treatments outside by even plastic surgeons. It's sad to say, but they don't have a very artistic eye, because if you put too much, you look at it. And what I was trying to show with the little videos was exactly that. Why did it takes, those were not sped up. Usually, sometimes if I put on Facebook, I make the video a little quicker, but the pieces that I showed you today were real time. So 1 minute it takes for you to make one cheek. You look at it from every side. You look if it's too much, too little. So you don't put too much. You have to learn actually the fact of swelling associated, because has no side effect, but you're creating trauma, which stimulates from the body a good response that we want. But at the same time, the little bit of swelling is there. So less is more. Remember the advice I said before. So first, you stay a little less than you think you need. And then as you develop experience and the body response, the particular person body response, that's why you do 2-3 treatments to obtain the desirable result. Because many people just put a lot of a product in, and this ruins the body, because that ruins the excessive volume. But this is in your brain and in your heart preparation as a doctor to do no harm. So you'll be very cautious, very careful, and you tell the patient that. You say, I want to make sure that we don't distort the facial expression, traits, lips. We don't want to look fake or strange. We want to improve. We want to go back to where it was. And I think that if you manage to talk to your patients this way and are always on the safe side, and as you become more secure, then you can do this is when I say you don't create problems, because it takes a learning curve just like everything else. And when you feel more comfortable, you do more in one session only. But you cannot create problems. This is why it's so special for us, that you don't do anything terrible.
Definitely, ma'am. Okay, so next part of the question is, how long is the effect of derma fillers?
The effect is around 6 months for every single 4 to 6 months for every single application. And this is also very relevant because people that exercise a lot, they will metabolize faster. And a lot of people that seek facial aesthetics are health freaks and maniacs. They exercise, they do, or just people. So in a person that has a more relaxed lifestyle, it will last longer. In a person that has more active metabolism, it will be metabolized faster. But again, better than a hyaluronic acid. It will stay longer than a hyaluronic acid because it becomes your cheek. But if this person burns, then they will keep burning while you keep producing. So that's what makes the difference in the length of duration.
Definitely, definitely. So one question is from Dr. Parth. Is it fifth generation PRP can be used in lip fillers?
Yeah.
Is the fifth? Okay, it can be used.
Yes. What changes is the amount of liquid that you put inside. And that's also where you become a little bit of an alchemist, and you can test your skills because they give you a recipe, but you need to adapt it to each person. That's how we do all of our treatments. We learn a guideline. The first, when I started doing endodontics, after a few teeth, I said, where is one that looks like the book? There was not even one. What they told us was the normality was not in reality, you know? And so all of these things always make us be alert of changes. So you learn what the different setups are, what the different mixing ratios are for the lips, for the eyes, but then you kind of try and see what looks good to you. And this is really the beautiful artistic part of this side of the job. It's a very artistic part of dentistry, very artistic. And so also the mixing is artistic. What you need to know is what inside, the guidelines. This helps you explain to your patient, or explain even to you why would you want to do something like that. Some people still have some reticence, some reserve against doing facial treatments. But knowing you're using something natural makes you feel like a real doctor. And also, you're doing something good. So play with it. That's why I had to mention the courses, because you have to learn from someone, and then you see what works better for you where you are. That's my advice.
Definitely. Next question is from Dr. Suraj. Ma'am, can we do patients with PRF fillers having skin diseases like herpes, lesions over facial skin, and patients with dermatitis problem?
Okay, I believe just in the moment of the outbreak of herpes, it's not a good idea in general for any type of skin procedures, because you can cause a breakout even more. But for any other type of situations, anytime, erythema, any skin condition, it's actually amazing how it helps. Remember I said that it's anti-inflammatory, so I would definitely use it to treat active acne. I would inject it there, and I've had great results with it. Now, it wasn't the purpose of this, but you can use it for acne scars, because acne scars need to be lifted and feathered under, so you detach these scars that are deep, and you can fill them with the filler form, and then heal them with the liquid form, and doing micro needling. So it's really good, actually. It's a way that you can treat those skin conditions.
Definitely.
So you can also do the treatment, and let's say usually herpes is on the lips, just stay away from the lips that day.
Yes.
But see, that's another thing. When you use derma fillers, hyaluronic acid and anything not natural, let's call them not natural. I don't mind them. I use them, the hyaluronic acids as well. Some people, it's hard to get the blood. So, I mean, I'm not demonizing. I want you to make an informed decision and know the different things you can use to do facial aesthetics and the characteristics of each, so that when you talk to your patient, you're more credible because you know what you're doing. So normally, when you have, remember we said rash as a side effect of hyaluronic acid and other fillers, but also they can give herpes type. I didn't want to tell all the different side effects because it would take too long, but that would create herpes type reactions, all kinds of rashes and skin conditions, and worsen some other skin conditions. Or there's an absolute contraindication that if you're having a moment of an allergic reaction, dermatitis, any kind of things, and you use other treatments, it's best to wait and lay off or take some medication at the same time. Whereas with PRP, you use PRP to cure the condition, and it will not give you a delayed reaction of herpes unless you're a stressed person who gets herpes, whatever they do. But that's pretty rare. Usually they know, they tell you, so it wouldn't be a surprise, but it's not the cause of PRP.
Definitely, ma'am. Ma'am, I have a question that, like injecting PRP, does it causes hypersensitivity in any case? Like we are having activated macrophages, so in any ways, can it cause hypersensitivity to some of the patients or like that?
No, because it's your body natural sensitivity. It does not, this is one thing that needs to be how do you say, addressed, and needs to be accepted scientifically, is when we studied in school, why are we dentists? We believe that what we do as a pattern, but we can heal the problem, right? We all believe that. So because what we're doing is, we could call in surgery GBR, guided bone regeneration, right? Here we're guiding tissue regeneration, but we're doing the same thing with our own body with a product that's ours. In guided bone regeneration, we use porcine membrane, pericardium membrane.
Yes.
We use things that are not human. Here it's mine. It's kind of like I take my hair and I place it somewhere else. And so it's completely autologous. It's not even from a cadaver. It's mine. It's mine. Cannot, because it's the same healing path that I use when I get cut, when I try to defend against the, why, if we remember, I know it's hard sometimes, is we don't remember what activates the sensitivity. What foreign, the word is foreign. Foreign activates,
antigen.
right? So
Yes.
if I introduce my own blood, how can it create and stimulate sensitivity in the same sense of a foreign? It will not.
Okay.
That's once you master in your mind that that's what it does, that's when you become excited, I think.
Definitely. Yes, ma'am. Next question we have from Dr. Dimovska. Do you combine PRP with other materials?
Yeah, you can, as I said, play around with it as much as you want. You can combine it with dermal fillers, hyaluronic acid. You can do really a combination of situation. It's perfect for, there's nothing wrong with it. There is no wrong sides to it. And if you look in the literature, you will not find it. There's no, of course, some people try to say certain things, but in the form of heating, what caused all of this drama?
Yep.
The fact that people were doing PRP liquid only, and they were claiming that this did augmentation. Okay, so I think I explained to you, and that's a beautiful question, because that's the same question I had. That's what made me go and research and try to understand. And this is why then I ended up meeting Dr. Gar, because I heard the same things that you said. I had the same doubts, and I wanted it to work because of the reasons that I started from school. But then I was using the liquid form and I was not seeing the results. And I was like, yeah, it's a beautiful skin, nice, but if I feel the lips, if I feel it here, then it's gone. And it was gone in 2 weeks, the time that it takes for the liquid to express. And so it was better, but it was not the same as a filler. And what's the difference? We make it solid by heating. And I like to use this analogy. The egg, you take an egg and you cook it, it's liquid in the, those are albumin, just like, that's why it's called albume of the eggs, because, I mean, egg white in English, but in Italy we call it albume because it's made of albumin. And if you cook it, it becomes solid. But try breaking an egg white. It does not become creamy unless you really crush it. And if you looked at the little video that I showed, it was very thick, and you could see the little pieces that it was breaking into. When in the syringe at the very beginning, it looked like an egg white. And then if you start massaging it, then it breaks down. And then, of course, depends on where you want it. So at the beginning, it will be a little lumpy, and that's why you hide it under, because you want volume. If you don't want volume, you can make it as creamy, as smooth as you want, and then it will fill the lips anyway.
Definitely.
Make it
Absolutely.
I hope I answered your question. If anyone wants to, correct me or tell me that, help me understand better the question, please do.
Okay, ma'am. Surely. Next question is, what size of cannula do you use for plasma lip fillers?
For the lips, I don't go bigger than a 25, 23. And then you can be bigger as you go to the other areas. Bigger is no problem at all. So you can go even 18, 19 gauge. You can just be, I don't go very little with those, no. And no smaller than a 25, because the reason we use a cannula is not to traumatize the vessels and not to enter the vessel. So if I have a cannula that's bigger, so for instance, here we said we have the facial artery, could be anywhere. Let's say I puncture here, I enter with the cannula, and I go straight inside the artery or the vein. That's what I don't want to do. So I want a cannula that's bigger than the potential vessel in which I can go to. And also because it's easier, it helps me see where I'm going. And also because it's a fake idea of the smaller, the better, because a small cannula can be just as dangerous as a needle. And if you, I saw some testimonials, some experiments with a balloon, and from a 25 on cannula, it would not poke the balloon. But if you go smaller, 27 and smaller than that, then you risk poking and piercing and creating more bruising and trauma. And so I prefer bigger cannulas.
Okay. Next question is from Dr. Suraj. Do you use any sort of anesthesia during the procedures?
Thank you for this question. Yes, I do, but only in the entry points. I like to use a facial cream anesthetic. Yes, sorry, maybe I didn't mention that. I cover the whole face for about 15, 20 minutes with an anesthetic cream, so that my points of entry are more, because I do microneedling as well, or maybe I inject the liquid with a little needle under if they can handle it. Some people are stronger, some people are more sensitive. If I can inject little papules, like a mesotherapy type of thing, I prefer it. If I can't, I just use the microneedling. So in the skin, they have this compound cream. The pharmacy makes and mixes, and I'm always looking, I don't have the magic formula. I'm always looking for something that works better than, because I want my patients to be comfortable. So I'm always looking for something else. But I can share the composition that I use, and I don't say, this is the best I found so far, but if there's one better, I'm open to trying it out. And then I inject lidocaine with epinephrine. This is why in some of the pictures you saw a little white spot. It was the epinephrine from the anesthetic. But I only inject where I think I'm going to put the port for my cannula. So the needle needs to go in first, of course. If some of you are already experienced and know what a cannula is. For the other ones that don't know, we need a needle to pierce the skin, and through that we glide the cannula. So that's the only place where I put anesthetic. The rest is all done with no anesthetic, being gentle, going little by little, and it's, as you saw, it was very tolerable. Because if you put liquid of anesthetic, then it falses your perception on how much you're augmenting, because part of it is going to be liquid PRP, and that you want, but not too much, because otherwise that's going to be gone if you're augmenting. And also that's answers the question, how much does it last? How much do you need? If you put a lot of liquid, all the volumization is going to be liquid, not the filling that's going to stay. And at the same time, I try to be as gentle as possible, because I don't want to use too much anesthetic. If I need it, I use it, of course. If I see the patient is too sensitive, then I make some more anesthetic. I mean, you know, we try to, it needs to be a beautiful moment, not a traumatizing moment for the patient.
Definitely.
So as soon as they even look strange, I ask, are you hurting? I do, so depend. But if I can, I only do the entry point away from the dangerous areas. And that's all I use as anesthetic.
Okay. So next question is from me itself. So, ma'am, actually, I wanted to ask, like, can PRPs be used for hyperhidrosis?
Hyperanhidrosis, where the sweating, right? No?
Yes, excessive sweating.
No, because that's not its job. The hyperhidrosis is for Botox. So it's different thing. Botox is a neuromodulator. So it's something that works on the nervous system, and it prevents an action of a muscle. So the definition of what it does is different, okay? And this is why PRP creates new things. Just to be simple, creates new blood vessel, creates new cells, creates new fat pads, and can differentiate into those things. The Botox cures those type of conditions because it relaxes. So the hyperhidrosis would happen because the glands are too stimulated. If we relax the transmission of the nervous impulse that makes them secrete the sweat, that's when it works. So they're totally two different things.
Okay. Next question is from Dr. Parth. What if we inject it in blood vessels? Should we aspirate before injecting near blood vessels?
We can, but honestly, I've not seen anything. If you think about it, it makes sense. Why I'm not advocating that you go and inject into the blood vessels, but what I'm trying to share is my experience and my reasoning behind what happens. Okay, if you think about it, if you inject hyaluronic acid in a blood vessel, it's viscous. It's the carrier that plugs. If you think about a gelatin, sticky something that goes into your tubes. When you're at home, your mom says, don't throw the slimy in the sink because it clogs the tubes, right? And the same thing happens in an artery where the blood, the hyaluronic acid goes because of the carrier that's viscous, and it has to be sticky because even the hyaluronic acid, you want it to stay where I put it. You don't want it to be dripping somewhere. And so the stickiness clogs the vessel, okay? This is the normal problem that we have. And then the blood cannot go through, and so you have necrosis backwards, and death of the cells, and oxygen doesn't permeate. Now, if you saw the big, the squeezing part that I did, you could see that it had little beads. When I break the PRP, the heated form, it's small micromolecule. As much as I mix it, if it's too big, no big deal. It's its own blood. It's blood cooked, okay? So what happens? Number one, as soon as I inject it, it will create new blood vessels. It starts immediately giving instruction to recruit new blood vessels. So vascularity in that area, even if it's obstructed, number one, it doesn't bother it. Why? Because around a molecule, a blob, a little drop of PRP, the blood vessel can expand. It can go under, it can go over, because it's its own, okay? And if it bothers it, it calls the macrophages that break it down, and in the same time, you get all these other blood vessels, because all of the side effects don't happen immediately, they happen over time. And in the same time that a bad consequence would happen, you are creating a new network of nutrients. So the exact mechanism of why it doesn't give problems It's not been documented or described, but it makes sense that this would be the case. So you would, and it happened to me, you see the blood vessel a little chubby, so you don't want to inject into it just because maybe then it shows too much, but not because it will create a problem.
Definitely,
You
ma'am.
can also the blood vessel and it looks all chubby.
Okay. Actually, the lecture has been too much interesting for everyone, and we have loads and loads of questions for you
I'm
now.
right here. If you have time, I have no big, no problem.
We
I love
actually,
the questions, everyone, for your question. That means that you liked what I presented, and I
yes,
hope this is what I want. I mean, we're in this together. We're all dentists. I was seeing too much ugly stuff out there in facial aesthetics, and so imagine how it excites me. And I believe dentists belong doing facial aesthetics because we're used to working the finest to smallest thing. We look at the face from day one of our profession with the smile design, with the facial analysis. We are there looking and creating beauty with our beautiful teeth and trying to reproduce nature. And so we're delicate with our surgeries. We're delicate with whatever we do. We have the smallest needle. And so I totally believe that the more dentists that get together and find out rewarding it is also. You saw the patients, they were laughing. Usually when we do everything else, they hate us. But when we make them look a little better, then we can just merge this. Okay, I need to do this too, but also a moment where I can do something for you. And it's also very important for their self-esteem. We can influence their lives. We can do something really special. Go ahead with the question.
yes, ma'am. Like, since we are having less of time, so we'll take one other question, and rest of the questions will be answered by the speaker in the comment box itself. Okay.
Okay.
So the last question which we're taking is from Dr. Suraj. Does PRF fillers depigment the skin?
I didn't understand the last part. Sorry.
Does PRF fillers depigment the skin?
Pigment? No, 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 no. No, no,
No.
actually it creates a beautiful pigmentation. That's the thing. Stem cells means progenitor cells. Remember this part. Progenitor means they can become anything. So it will take the color, it will take the nature of where it's supposed to be. That's why it's beautiful.
Okay, so I think because less of the time, we can move on to the commencement of the session. And moreover, we are having loads of questions that will be replied by the speaker itself. So, ma'am, thank you so much for the wonderful oration and a beautiful session.
Thank
And
you.
yes, ma'am, would you like to add some words at the end?
Just everyone stay safe. We're going to get through this and we will find a beautiful place and world to deal with. We have to be strong. We have to project this strength to other people. We have to thank God that we're alive, and we need to pray for those who have had problems and have dealt with it in first person. We have to be grateful for the doctors that fought all of this, but it will be over, and we have the duty for all the ones that are not here anymore to keep going, to leave, to learn from what happened and make the best of it. And we will see each other one day somewhere because the world now is connected. And so I hope I helped you pass a little fun moment and take your mind off of more serious stuff. Okay.
Yes, ma'am. And
Thank
thank you, ma'am. I hope everybody, has got an ignition of, going towards PRP itself. So thank
That's
you so
right.
much, ma'am. With this, we'll move
For
on to the
having me.
commencement of the session. Thank you so much, ma'am.